On August the 1st last year, my world collapsed basically because I was rushed into hospital with a pulmonary embolism. So I'm quite independent, I'm very independent. I could never imagine my life not looking after myself and being in my own flat and doing all the things with my grandchildren that I like doing.
So Urgent Community Response Teams is a collective of community teams that respond to urgent or crisis needs for patients. So our response times are within 2 hours, so we will go out, assess the patient in an urgent health or social care crisis, do an assessment or carry out an assessment. We could treat, we could do bloods and put a plan in place for those patients. We have in the teams a collective of nurses, paramedics, physios, occupational therapists as well as healthcare support workers.
They can go out and see patients that have got maybe mobility issues. They can get urgent equipment in like commodes, hospital beds if required. We also at the moment are having high referral numbers for falls. We've got a great bit of equipment called a razor chair, so we can pick patients up that have got non-injury falls. We also take a lot of referrals for GPs or nurse specialists at the hospital for urgent blood testing to try and keep patients at home as much as possible.
I was actually referred into the service, the urgent response service. I was just amazed. I mean, I've often said that some people feel your pain, and they obviously did. They were actually quite ever so good on that way. Most nurses are, but these were absolutely exceptional. And I felt almost quite like I had exclusive nursing, which I did to myself. So to have this sort of service available to me, if needed, means a hell of a lot.
The aim of the UCRT is admission avoidance. So the referral pathways would be a GP could refer to us, a paramedic on scene with a patient could refer to us, a carer in the community. We now have wraparound services such as the frailty virtual wards. So we can refer patients on to the frailty virtual wards or the respiratory virtual ward. And I believe there's also an upcoming heart failure virtual ward as well. So that's the pathway for the patient, and ultimately the aim is to keep the patient at home and away from the front door of the hospital. So there are several benefits, I guess, in our pathway. So you're avoiding an attendance to the hospital or A&E, you're avoiding, hospital admission. You're also helping with the system pressures, so reducing the need for an ambulance to attend, so they can free up the time to go and attend perhaps somebody with more life-threatening emergency. And you're keeping people at home, closer to home, and promoting independence. We also work collaboratively with partners, so like social care, to assist in terms of if it's a social crisis, we can arrange a package of care, for example. In worst case scenario, we could assist, or social care could also help us in terms of assisting for somebody to go into respite, for example, just for those few days until they're back on their feet or their baseline. It's one number across the MSC regardless of where you are via the single point of access. So our single point of access is staffed by very experienced clinicians, so combination of nurses and paramedics. You can have a clinician to clinician discussion. So if you're not sure whether the patient is suitable for our service, pick up the phone and have a discussion.